Today is the first day of National Heart Health Month, and it's all about raising awareness of heart disease and heart attacks and prevention of. With us now is a man who knows all about that. He is Dr. William Cooper. He is a heart surgeon. He's a professor. He's an author. He has a podcast. This man does it all. He is known as Coop, the doctor, the heart doctor. And Coop, we appreciate you joining us. Should I call you Coop or Dr. Cooper?
Man, you can call me Coop, John. You're my friend now.
Thank you. Yes, I feel that heart-to-heart connection here, Coop. I appreciate that. Okay, so first of all, let's talk about some of the misconceptions about heart disease and heart attack.
Yeah, big misconception is that this is a disease of an older, overweight, obese male, diabetic, smoker, drinker. And that does happen, okay? And it happens very frequently. But the fact of the matter is I've operated on literally thousands of people throughout my career. Some as young as age 27, bypass surgery, imagine that. And so the message there is that this can affect anyone at any age, and that's important because it's important as a young person to begin to incorporate healthy lifestyle choices very, very early, not when it's too late. So that's why we're here to educate people on that today.
Yeah, Coop, I wanted to talk to you about the fact I was doing my research, and from what I understand, in the period in which we do this interview, 6 people will have had a heart attack. That is almost hard to put your arms around and grasp that. With that being said, give me some good news, maybe some innovations when it comes to treating heart disease and heart prevention.
Yeah, it starts with healthy lifestyles lead to healthy hearts. And so we have to just, go to the basic thing, okay? But diet being the #1 factor is also sometimes very difficult for people. So my strategy here is to try to sort of flip that on its head, make it practical. Let me give you an example. I love peanuts, okay? Peanuts and peanut butter have been shown to lower cardiovascular disease risk, blood pressure, risk for diabetes, etc. The southern peanut growers know that, and they know that you can incorporate this into a heart-healthy diet. Why? Because peanuts have a lot of unsaturated fat, which is easier to burn. It has the heart-healthy nutrients like fiber, magnesium, vitamin E, and the most protein of any nut out there, okay? So how do you do this? Incorporate it into your diet. Change out the jelly on your PB&J to some fresh fruit on a multigrain bun. Toss some peanuts on your salad, on your stir fry. So it makes you feel good about enjoying something that you love, but also incorporating it into a heart-healthy approach to your diet.
Doctor, this is really good advice. Do you have any other tips or suggestions for us as we try to be proactive in taking care of our hearts?
Got to exercise. Regular exercise is absolutely #2 on my list, critically important. No better time to start than now, February, Heart Health Month. Planet Fitness, the judgment-free zone. They're there to help. They help people reach their fitness goals, boost their energy, promote physical and mental well-being, as well as help you get onto a healthy lifestyle track. Very important. So throughout the month of February, and in honor of Heart Health Month, Planet Fitness will be showing their love with a free heart-healthy collection of workouts on their PF app. Those workouts range from cardio to yoga to toning to stretching. All the things that are going to benefit your heart health, help you elevate your mood, as well as increase your energy, and more importantly, lower your risk of heart disease.
Coop, from what I understand, someone may have a heart attack and not even know it. So if you would, maybe share some of the warning signs that we should be aware of when it comes to heart attack.
Yeah, very, very important, John. So we need to be aware of those signs and symptoms. Shortness of breath, twinges in our chest, tightness in our chest, pain that just doesn't quite feel right, okay? Gastroesophageal reflux or GERD or heartburn. Remember, that could really be your heart burning and not necessarily just your esophagus burning from eating chicken wings, okay? So you have to be in tune to those things. Women, very important for women to note that heart disease signs and symptoms are different than they are in men, okay? They can be very subtle. Depression, fatigue, anxiety, generalized muscle aches, and those things are very common in women. Back to the exercise piece. Important to exercise, not just for the benefit, direct benefit of the exercise, but think about it like this. That exercise, every time you do that, is a little mini stress test. You've been able to do that treadmill for 30 minutes, and now all of a sudden, not all of a sudden, but gradually over time, you can't do only 15 or 20. You need to report all of those things to your doctor, because all of them could be a sign of development of heart disease, okay, and which could lead to a heart attack. So important to be in tune to your body and understand those warning signs.
Something you said at the beginning of the segment, Dr. Cooper, and I want to be clear. I think a lot of us think, well, I'm okay because, you know what, no one in my family's ever had a heart attack. I'm not a genetic kind of risk. That's not true, right? Once again, you said anyone can suffer from a heart attack, correct?
That's absolutely correct. We know that family history and someone in your family having had a heart attack, all that does is places you at much higher risk. That doesn't negate the risk from all the other things that perhaps may afflict you, the diabetes, the overweight, the smoking, the drinking, and all those excessive drinking, and all those things. So yeah, that's, you know, if you have that family history, higher risk, you should really be in tune to lowering your risk factors. But that doesn't mean you're not at risk, and that is the message. You're absolutely correct about that, John.
All right, Coop, on my way home, I'm going to stop and grab some peanuts and some peanut butter. I'm going to stop at Planet Fitness and get a workout in. Also, I want to let our viewers know, where can they get your book? I like your delivery here. Where can they get your book?
Absolutely. My book is available on Amazon and all books, online booksellers. You can also go to tipsontv.com. We have a lot of information on there about the things we discussed as well as about the book.
Dr. William Cooper, thank you for your time. Coop, I appreciate it. And real quickly, a shout out. Did you tell me that your daughter played volleyball here at the University of Louisville?
She sure did. So, I think Ann Cordis was the coach back then. Yes, absolutely.
All right. Well, they're good. We have a heart-to-heart connection. I really appreciate your time and your expertise.
You got it, my friend. Take care. Have a fantastic day, John.
You too. All right. Good information there from Dr. William Cooper. Coop, he is known as the Heart Doctor. Okay, coming up here, cold weather moving in on Friday. You better check those windows. We have a deep